Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, as the 20th anniversary of 9/11 approaches, I talked to Dr. Tom Inglesby about the transformational impact of those momentous events on the field of public health preparedness. We discussed the anthrax attacks that followed soon after 9/11, the major investments made to protect against manufactured and natural threats to health, and the legacy of these investments for the U.S. response to COVID. Dr. Inglesby is the director of the Johns Hopkins Center for Health Security and a national leader in this field. Let's listen. Tom Inglesby, it is great to have you back on the Public Health on Call podcast. We are talking 20 years after 9/11. Now, 9/11 had enormous consequences, and there's many, many podcasts that could be put together about 9/11. But I want to talk to you about the seismic impact that 9/11 had on the field of public health preparedness. And starting with this question, why did 9/11 have such a seismic impact on the field of public health preparedness when it was a terrorist act?
Well, first of all, Josh, great to see you. Great to be with you here on the podcast, and congratulations on your amazing success on this platform. But and great to talk about public health preparedness and where we've been and where we're going. Looking back at 9/11, I think the fact that 9/11 was coupled with the anthrax events and that they came together and were all together so frightening for the country, affected all the, kind of all three branches of the federal government, places around the country, and then required a systematic public health response around the country to the anthrax events at that time. I think that really exposed vulnerabilities that most leaders did not realize that we had, and it showed how fragile a lot of our public health response was and how much work we had to do. And so it was 9/11. I think 9/11 certainly exposed our vulnerability to major challenges, to disasters, to terrorist events. But it was the anthrax letters that were happening around the same time that really focused a hard look at public health response and helped create energy in Washington, and particularly on Capitol Hill, on providing funding and starting to ask a lot of hard questions about how public health is organized to respond.
Got it. Now, I was working on Capitol Hill at the time, so I remember the anthrax letters very, very well. But maybe for our audience and people who think of 9/11 primarily as the attacks on the World Trade Center, the Pentagon, how would you refresh their memory about what happened with anthrax?
Well, yeah, in the weeks that followed 9/11, letters started to arrive to various, high-profile figures on the Hill and in the media, and ultimately to other individuals, other Americans, that contained dried anthrax powder, or Bacillus anthracis powder is the more proper way to say it. And a number of people got cutaneous anthrax, a number of people got inhalational anthrax, and a small number of people died from that event. And many, many thousands of people more were frightened by the clear vulnerability that we all had to this kind of silent, unannounced arrival of anthrax powder in the mail. And it played out over a series of months and led ultimately to the contamination of major buildings, to changes in the way that mail was processed, changes to the way that we diagnosed anthrax as an infection, and major attention from the White House to the Hill, the hearings, to media coverage across the country on a daily basis. So it was quite a shocking additional concern after 9/11 that I think really galvanized things.
So the 9/11 attacks themselves really exposed the vulnerability of the United States to terrorism, but it was the anthrax attacks that put a real spotlight on the public health side and the vulnerability to biological attacks.
Exactly. So while the anthrax letters were a deliberate event, they were sent, by an individual to make people sick or to kill people. It also became clear in the months and the years that followed that our overall approach to responding to biological threats, whether they were deliberate, like the anthrax letters, or they were natural, like the experience we're all living through now, that we had, our systems were fragile and nascent. And in the healthcare system, for example, preparing for emergencies was an after-hours avocation at the time. There was really no dedicated cadre of people that were thinking about how do we respond to infectious disease threats or to other public health threats. And that whole system had to be built. It had to be built in public health, in the healthcare system, in the scientific community. And I think that's what happened in the years to follow.
So take us through the consequences of 9/11, the anthrax attacks, for the field of public health preparedness.
So I think, kind of in different categories. One of the consequences was that within the next year, there began to be funding dedicated to public health agencies. So funding for work like detecting disease or doing outbreak investigations and risk communication and laboratory science and building those things up. So that funding began to move towards public health, and expectations were also set for public health. CDC started working with public health agencies to set up a whole framework for thinking through public health preparedness, a term many people hadn't really heard before. Also in the healthcare system, people began to start, kind of thinking through how hospitals should respond to big infectious disease emergencies, including pandemic influenza, other kinds of threats, like we saw years later with SARS and Ebola and Zika. And there was much more attention to this problem on Capitol Hill. As you said before, you were there. So began to think about how labs should work with pathogens in ways that, kind of didn't lead to accidents or didn't, expose labs to risks of theft or diversion of pathogens. So there were a series of kind of different categories of activity, both public health, laboratories, medical system. The basic science community also got a large infusion of funding in NIH, which then went out to universities to start understanding in much greater detail the pathogenesis around the most dangerous pathogens. And so a whole series of events followed that. And then within the federal government, one last thing to add is that there was a much greater focus placed on developing new medical countermeasures. So medicines, vaccines, and diagnostic tests for these kinds of unusual threats for which there really is no market, for which we really don't have anyone wanting to buy them except for governments. And so new programs are set up to do that. And I think those programs in large part have really helped serve as the foundation for this rapid COVID vaccine and therapeutic response in the last year and a half.
So I want to take a look at this impact of 9/11, the anthrax attacks on the field, maybe through your point of view. How did it change your career? What were you doing before 9/11? What wound up happening after for the things that you were interested in?
That's interesting to think back on that. So I had already been persuaded that kind of working on the preparedness and response to biological threats was a really kind of pivotal area of work. And I had been persuaded by the former dean of our school, D.A. Henderson, who was personally very concerned about it and thought that those issues were flying way below the radar and needed much more attention. And so he had started working on those issues in 1997, 98, 99. And so there was work going on, but it was at a much lower level, much fewer people. And then the events of 2001, 9/11, and the anthrax letters really, I think, brought many more people, a lot of talent, a lot of funding and energy into the field. Because as you peel back the onion on these problems, you see that there are many, many layers of challenges, and they require professionals from so many communities, doctors, nurses, scientists, public health professionals, logisticians, to do the kind of planning that we need for something like COVID or something like the response to Ebola or Zika. So in my career, I think I was already drawn to these issues, but they were moving along at one pace, and really kind of thanks to D.A. Henderson, who really kind of got things moving. But then 9/11 and 2001, those tragic events really accelerated the attention to them, and also, kind of brought me much kind of more into different communities that now were worried about this.
I have this metaphor in mind, a roller coaster ride where it was just sort of starting kind of slowly. And then when 9/11 happened, you were just holding on at that point for a while. Just so many different things were happening, because I know
that's true.
I know all of the work you've done over the last couple of decades in this area. I want to ask you a question that I've had in my mind for a while, because I was on Capitol Hill, during 9/11, but I also was in a local and a state health department and saw the preparedness programs stand up and what they could do. And I think that you're absolutely right that you can see in some of the successes that the U.S. has had the fingerprint of the response that happened back then in the rapid development of vaccines, for sure. Also, I think in the pods, the so-called pods where so many people can get vaccinated, that actually came out of drills where health departments were planning to distribute antibiotics against anthrax because of the anthrax letters, right? So you can see that fingerprint. But I want to ask you maybe a more challenging question, which is, do you think that the focus on the terrorist attacks, man-made attacks, may have made it harder for the U.S. to be prepared for an event like COVID? Or more generally asking the question, where, if you could go back, do you think that the response to 9/11, the anthrax letters, let us down insofar that our response hasn't been a series of successes? We've had all these different challenges, testing, all these different challenges that have happened. How do you look at the results of the test that COVID was for the system that got created?
Yeah, a lot of good questions in there. I know a number of people have asked that fair question: do we overcommit or over prepare for one kind of challenge at the expense of another? I don't think that's the case. I think in the early years after 9/11 and the anthrax events, there was extraordinary focus on responding to bioterrorism, just as there was to responding to preventing the kinds of events that happened with 9/11 again. But over the years, it wasn't too long into that new funding stream, that new level of energy, that the money became clearly purposed for much broader preparedness, for pandemics, for, quote, all public health hazards. It's always a tension between, do we prepare for particular events and go down 5,000 feet into that event versus trying to prepare broadly for all hazards, and that's always going to be a tension in public health. I'm sure we always get it a little wrong, or maybe a lot wrong, and we move in one direction or the other. But I think over the years, it's kind of vacillated depending on, different leaders' priorities. But I think, in my view, the whole thing has been moving forward generally together. And I don't think we have the luxury of being able to pick one versus the other. I think the event of next year could be something that is deliberate, or an accident coming from a laboratory. I hope none of these things happen, but I think we have to prepare pretty broadly. So I think on the whole, the money that arrived after 9/11 and anthrax was, quote, new money. It was not money that was taken from other events like something else. It was new money delivered to public health. And that money has largely continued since then. So I think it was useful. I think to your question about, lessons that can be learned in the last year, where do we underprepare or misprepare? I think, that's going to take us time to really sort all that out. I think we have we have not had the ability to do national operational planning at the scale that would have been required for some of these challenges that we're facing. For example, I think you're talking about the testing problem. There's a lot of attention paid to what happened at the beginning of the pandemic in terms of testing and our national laboratories. And I think, at a simplistic level, I think we focused a lot on the initial discovery of the virus and being able to characterize it, but did not spend enough time on drawing in industry and translating what we knew at our national laboratories at a scientific level into a mass operational response that could be carried out across the country. It seems so obvious now, but it just, in the planning, there were blind spots. So I think hopefully we'll react to those blind spots as we are able to kind of take off, stop paying attention to the Delta variant which everyone is consumed by now, but those are really important questions to ask.
Let me ask you one last question. I hear what you're saying, that this money started initially focused on bioterror threats, but was brought in for pandemic and, had a lot of important benefits for planning later, even if there were blind spots, as you're saying. How do you handle the critique that the response to 9/11 and the anthrax letters was to add this to the portfolio of public health rather than strengthen kind of the core infrastructure of public health? And that what we're seeing with COVID, and particularly with a challenge that's lasted for so long, is that it's very hard to manage something like this if the core elements of public health are underfunded. Do you think that is a lesson looking over the last 20 years?
I absolutely agree with you that the core elements of public health are underfunded, and that this was added to the plate of public health with some attempts that were, only modestly successful to try and strengthen public health more broadly. I am hopeful that the events of the last year and a half will make the absolutely compelling case that we depend on public health just like we depend on fire departments and other major safety systems, and that we will now kind of use this next couple of years to reset the baseline of public health capability at a much stronger level. It's always been funded at a penny on the dollar to our traditional hospital and healthcare systems. Unlike many other countries in the world, most other countries in the world where public health is much more integrated. And I think, and you've been a leader in that field, Josh, thinking about this. And I absolutely agree with you that we should use this moment to fund public health foundations and capabilities at a much stronger level going ahead.
It's really not either or. We want to have the preparedness capability that's very focused for large emergencies, but doing that without shoring up the core parts of public health make it very, very hard to run responses, particularly when it's more than just getting everyone antibiotics over the weekend or something.
Absolutely. Couldn't have said it better. I completely agree with you, Josh.
All right. Well, that's the goal for every podcast, Thomas.
That's how it should all end, right? That was great.
Yeah. Thank you so much. Thanks for everything you're doing now with the pandemic and your just incredible contributions to this field over the last 20 years.
Thanks so much, Josh. Good to be with you.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.